Okay, so thank you everybody for being here and welcome to our February webinar on the Erasmus Jean Monnet Excellence Center. So we have as our guest speaker, Gökçe Manavgat from the University of Toros in Turkey. She's from the Faculty of Economics, Administrative and Social Science, and she works as assistant professor. Thank you very much for being here. Her research interests include microeconomics, welfare economics, and social choices, as well as we're going to see now, health economics and industrial economics. So we are very happy to have you here, and we are gonna have a really nice time discussing about the potential of health economics impact on circularity. So the floor is yours, Gökçe. Thank you again.
Thank you so much for your kind introduction. So today I would like to talk about the potential health economics impact of circularity with refocusing on opportunities and trades. First, let me introduce my outline of presentation. I will mention about the transaction to circular economic models, health impacts of circular economic models by opportunity trades, and then I will present general conclusion, and also I try to give a key message of circularity and health. The circular economic is often represent the general terms in a transaction from linear, as we know, take, make, use, response model to circular, restorative and generative models. In the literature, however, offers no single and ubiquitous definition, but a general consensus on central concept and aim of a circular economy. The simple circular concepts also we can describe a loop including from production to recycling, which is including again consumption and reuse and repairing. According to EU Action Plan for the Circular Economy, describe the transaction where the value of product materials and resource is maintained in economy for as long as possible and generation of waste minimized. So here the key focus does on minimizing needs for now inputs of materials and energy, and they are reducing environmental pressures related to resource extraction, emission, and waste. So also circular economics is a kind of waste hierarchy. It's a guiding principle of minimization of the waste and action to reduce, and the waste management are given in order to present from preventing to dispose of. So why the circular economic model getting crucial, especially in health? So because it gives a tool to tackle climate change and biodiversity losses while addressing social needs. Also give us the power to grow prosperity, jobs, and resilience with cutting greenhouse gas emission, waste, and pollution. So also give a potential tool for improving of health. So we have to answer some crucial questions to evaluate the impact of circularity in health. So who is the most improved by circular economy waste strategies, and which determinants of health is well-being are most affected by circular economy waste strategies? So the first question answer is the whole population. So more specifically, employees of public bodies, low middle-level occupations, disadvantages, and poor areas. So also the second question answer is mental health, well-being, living environmental conditions, economical conditions, and macroeconomic environment and sustainability also most affected by circular economic waste strategies. So it's also important to talk about circularity within the framework of EU development plans. So because these plans are indirectly answer the health effect. So in the policy terms, the key European development is the adaptation of EU action plans for the circular economy. So this interprets the circular economy more broadly, saying as going beyond West and environmental policy to include innovative forms of consumption, moving away from executive ownership towards sharing, leasing, product or infrastructure, and consuming service rather than products. So the key targets for achievement by 2030 include common EU targets by recycling 65% of municipal waste, 75% of packaging waste, and building with target to reduce landfill to maximum of 10% of municipal waste. So the action plan acknowledged that the proposed option must preserve high level of protection of human health and the environment. But this kind of plans does not elaborate on the health-related aspect of the actions. So first, interpret the impact of circularity in health. We can focus on macroeconomic perspective. So it's considered the macroeconomic perspective as provides a background for driving a framework for analysis of the health effects relating to circular economy. The functionalization of the circular economy is in both economic and distributional context, and its implication for human health is so crucial. So at the macroeconomic scale, perhaps the most important trend to affect circular economic incentives in globalization. Okay, the increased interdependence of countries and world region for financial, human, and material resource are transport and communication costs have fallen because of the globalization. So it's also affect the people, maybe the health, by using these kind of activities. So common indicators of the globalization is surely trade openness. So 1916 to 2020, trade openness is devilishly increased around the world. So one consequence of these trends is that technological innovation that have arise from strategies for resource reuse, reduction in circular incentives in one country are more likely to export to others. So that's why it's important in terms of health. What we need to measure to circular economy in terms of a macroeconomic perspective and to evaluate by health. The adaptation and monitoring of the range of indicators of sustainable development, such as the undertaken by EU Statistical Office. So EU beyond GDP incentives is an essential first step in better incorporating incentives for circular economy in both macroeconomic policy planning. So further, for example, of the rather limited of GDP as a measure of welfare arise from observation that the pollutions were associated with the health impact than the both market and non-market costs. Market cost includes those for health treatments which would increase the GDP of the countries in which people are treated but are effectively incurred to restore health after pollution effects. Actually, there are limited studies that evaluate of circular economic action on a macroeconomic perspective by also the impact of health. For example, Landregan at all 2070s estimate the health expenditure are spending on disease caused by air pollution amount to 3.5% of health expenditure in high-income countries in 2030. So also the other main market associated with pollution is loss productivity arising from ill health. The same study estimates the costs from pollution-related disease amount for 1.3 to 1.9% of GDP in low-income countries, and only 0.05 and 0.1% of GDP in high-income countries. So it's finding it's, I think it's interesting for the estimation of the impact of the eliminating of air pollution and effect of health. Having too much payment to avoid actually promote mortality. So, the same studies evaluate when the component of willing to pay to avoid premature mortality is added to another two components, to total is estimated to be more than $4.6 trillion equivalent to 6.2% of global GDP. So it's quite tight. It's quite high. So another side, the risk caused by the climate change in health is widely range scale. So from the enduring fatality, mental health impact, asthma, cardiovascular disease, malnutrition, diarrheal disease. So many perspectives we can evaluate the risk posed by climate change in health. So maybe the circular economics has a great potential to eliminate this premature mortality. So if we look at the world's leading cause of that, the third place is chronic obstructive pulmonary disease. So it's the main problem of environmental, okay? So, and also lung cancers. So the cause of environmental, especially the air pollution. So it's also affects and also in the world, 5.8 million people die from the heart, lung disease, stroke, cancer, diabetes every year. This kind of disease economic burden plugged at in the economy, it's 2 or 8% of GDP. It's also quite high value. If we prevent this premature death, maybe it's global GDP. It's having this kind of funds to another areas to prevent this kind of death. So according to WHO, World Health Organization, around 12.6 billion deaths each year are attributed to environmental risk, including air pollution, water pollution, and exposure to hazardous disease chemicals. Circular practices such as recycling, reusing, and reducing waste can help to mitigate these risks by reducing the amount of waste and end up the landfill and polluted the environment. To understand the circularity, first we look at the health sector. Today, total health expenditure accumulated for about 9.9% of GDP globally and 9.5% of GDP in WHO European Union region. And the global health workforce was over 43 million with 12.7 million in European region. Thus, the sheer size of the health sector indicate the potential for considerable cost and studies efficiency effect from any move towards circular economy principles. There is a strong focusing on WHO for health implication in health economy, actually. The human right to highest attainable standard of health is ensured in World Health Organization and especially in United Nations Convention to Rights of Children, which is explicitly linked the right to health and population and contamination. The right underlines the importance of understanding the distribution of health impact in the context of circular economy. The impact of circular economy can be the impact of circularity in health. It's very controversial things. A negative health consequence of the specific circular economic action outline many disproportionately affect more vulnerable population like chemical of concern, food saved, and e-waste. On the other hand, the health benefits of the actions are likely to disproportionately favor vulnerable population by addressing inequitable environment determinants of health, such as air pollution and soil contamination. Given the importance of inequity in health is a key incentives, the distribution of issues outlined require further emphasis in research and policy development to minimize negative outcomes and promote positive outcomes for vulnerable populations. The application of circular economic models can affect the human health and well-being, as I say. The framework effect of circular economic activities, positive or negative, or direct and indirect, show different effect for different sectors. There is actually a mention used to measure these effects by World Health Organization, or WHO, and other institutions by combining these kind of forces or this kind of dimensions. This framework, it shows the linkage between health, environment, and development. One of them is driving force, pressure, states, exposure, and effects. This framework, driver, pressure, state, and exposure, effects, and actions framework is called by WHO. It's also referred this kind of evaluation. How can we evaluate the impact of circularity in health using this diagram? It's a kind of useful tool for mapping links and causal relationship between the political, social, and economic drivers of environmental pressure and states and their effects on health exposure and impact as a basis for identifying policy actions for better health and environment. So in fact, the impact of the circular economy on health is very controversial issue. So the health issue are included in, but not at the forefront, the number of the circular economic studies. Before they evaluate the opportunities and the trait of the circularity on health, at the glance, the Probit studies. So actually, there is limited studies about the evaluate impact of circularities on health. So the most studies on a circular economy issue to date focus primarily on the business case for enhanced reuse effectively. Another study found the information on the indirect effect on economy and the social impact of transaction, a circular economy, such as impact on gender, skills, job, poverty, and inequities. The other reports, Green Alliance in 2015 on social benefits of circular economy, focused on jobs and other economic benefit, does not cover directly health. But we can catch some impacts, but not directly. So another report, Club of Rome, on the benefits of societal circular economy in Europe, focused on carbon emission and employment benefits, which it's also limited coverage of health. So other literature covers health effect to waste management options, publications of WHO regional office for Europe, health impacts of waste treatment activities. The general conclusion given the WHO region office for Europe 2016, however, it's that the health effects of waste management disposal activities are only part understood, and definitive results, including accurate exposure information, are lacking in many cases. So there's a possible assessment, or there's a possible detailed assessment of human health and welfare implication for circular economic model as positively, maybe some sector. So if you look at these tables, for example, in the food sector, food waste, redistribution of the edible foods can directly health effects by reducing malnutrition and other poor diet-related endpoints. And waste reduction and recycling in health sector again. So it's also indirect effect, direct effect on health sector via reduced costs. So also it's reduced the cost, allow improvement to health service across all ends. Use of again recycled materials in manufacturing process, indirect impact via reduced manufacturing air water emission. So it reduces cardiovascular and respiratory disease. Reduce energy recovery, it reduces generation of population during energy recovery process. So reduce cancer, respiratory, and negative birth outcomes. So reduce the waste generation and production emission. So reduce indirect impacts from waste management, landfill, and etc., and from manufacturing water emission. So the various including reduce cancer and negative birth outcomes and respiratory risk again, we can state. And on the other side, it's possible to evaluate of the human health and welfare implication from a circular economic model, but this time we can face a negative impact. So here, wood waste composting, okay? Here, direct health risk from inhalation of bioaerosols, asthma, allergic alveolitis, chemical in food packaging, also exposure to chemical direct effects, epidemic effects. It's effect by health epidemically effects, but this year. So the e-waste recycling components, direct effects on indirect impacts via soil, water, and food and toxic byproducts. If we contact with hazardous disease waste, increased risk of injury in recycling process. And informal recycling, occupational health risk, and poorly regulated sites. And it's also increased the risk of accident exposure to hazardous disease materials. So it can be evaluate and scrutinize the negative impacts of the circularity activities in health. But how the sum of all, we can state the circularity in health and health economics with opportunities and threats. We cannot strictly the circularity is the best alternative to improving the health, but sometimes it's getting crucial negative impact on health. So if we count on the opportunities of circularity, one of them is cost saving. The circular economic model has a potentially significant impact to reduce costs in healthcare industry. But how? By reusing and repurposing resource, healthcare provider can minimize waste, lower product cost, and reduce over expenditure. So there is innovation. The circular economy model requires innovation to identify a new way repurposing, reusing resource. It can drive innovation in healthcare industry, encouraging the development of new products and services that are both sustainable and cost effective. So other opportunities and environmental benefits. The circular economic practice can reduce the environmental impact of healthcare. By reducing waste, healthcare providers can minimize the amount of waste is sent to landfills, reducing greenhouse gas emission by pollution. And health benefits. This kind of practices can also have a positive impact on health. For example, reusing medical devices can reduce the risk of infections. By repurposing medication can increase access to essential medicines. So if we turn to traits of the circularity in health, it's reduced profitability in health sector. The circular economic model may negatively impact on profitability of healthcare providers. So by reducing waste and lowering costs, provider may see reducing in revenue, a reduction in revenue, sorry. So regulatory challenges. The regulatory environment in healthcare is complex, and implementing circular economic practices may require significant change in regulation and policies. This could lead to increase the compliance cost in regulatory uncertainty. Limited availability of the source may be another trait of circularity. The availability of the resource, such as medical devices and medications, may limit the availability of healthcare providers to implement circular economic practice. To quality concern, maybe the last quality concern, repurposing medical devices and medications may arise quality concern, particularly if the devices or medications are not properly sterilized or tested. So I would like to draw attention one more thing about health expenditure per capita and carbon dioxide emission. So there is a strong correlation between these values. So 2000 and 2020s, as you see that this figure, the main challenge of the circular economy is to reduce the carbon emission. So also the impact of health. In conclusion, the circular economy may potentially have a significant indirect effect resulting from, for example, change in environmental impact from extraction, production, mobility, and consumption. The importance of the circularity in promoting better health outcomes for people around the world. The circular economy is a potential positive health implication related to reduced use of primary resources and maintaining the highest value of the materials and products, such as through recycling, the reuse of product components and materials. As the WHO emphasized the importance of circularity in promoting better health outcomes, and circular practice such as reducing waste, promoting sustainable food system, and adopting circular models of healthcare delivery can help to mitigate environmental risk and improve access to healthcare services, particularly in low-income and marginalized communities. Another key role of circularity is promoting a more sustainable and equitable food system. The unhealthy diets are the major contributor and non-communicable disease such as obesity, diabetes, and heart disease. A circular food system can circular food system that prioritize local, seasonal, and regenerative farm practice can help to reduce the environmental impact of food production while also promoting better health outcomes for consumers. The potential negative impacts identified related to unintended consequences of recycling and reusing product components and materials. The management of chemical of concern such as those found in e-waste, food packaging, and fire retardant in a variety of products to emission from the composting of waste. It's important to implication of the circular practices must be done in a responsible and sustainable manner to avoid any potential negative impacts. So actually it's a crucial concern to catch the more beneficial effects of a circular economic model. So, and lastly, this is the key message of the presentation about circularity and health. So if we keep the circular economic action more accurately, so it will lead to prevent climate change, resource use, reducing waste, promoting sustainable food system. So it also leads to increased sustainable manufacturing and food system, reduce premature and preventable deaths. So it's also directly affect to decrease the health expenditure on the world, and it goes to us the well-being and sustainable health and well-being process on the world. So that's my end of the presentation. Thank you so much for listening me.
Thank you very much, Gökçe. It was a really nice and really well detailed and amazing presentation, amazing lecture. I don't know if we have any question. Feel free to write in the chat or to raise your hands and if you have any question or comment. I have one comment and one question also for you, Gökçe, before checking if the audience has something else. It was really nice, especially the systemic approach that you are printing into your lecture, because we can see how circularity is having an impact on health issues I will start with my question first. We can see this relationship, but are you able to quantify the amount of impact from this source? For example, let's say incineration, because you mentioned also incineration into the medical issues that they are triggering, or is just the positive or negative impact what you're measuring?
So actually, it's a big challenging problem. So as you know, it's so hard to impact of circularity. It's many areas, not just healthcare. So that's why here there is no strictly consensus about how we can evaluate circularity in health. So I think it's more challenging question. So here, just we can think a systematic approach. So if we are doing this thing, blah, 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 it will affect us negatively. If we are doing this, but for example, as I explained before, so it's also affect us negatively and so on. So just now we are thinking about it's kind of systematic thinking. So we have I think it's very hard to measure the effects of the circularity. So I explained some studies about how we evaluate the macroeconomic perspective. Just the macroeconomic perspective we can evaluate. So not just by sector and a numerical. I don't know.
Yeah,
no, it's a big challenging question. I think.
Yeah, that's very
it's a good
true.
question. Yes. So many times I ask myself how we measure these big challenging questions.
And let me just give the reason, because I also studied this. As just said previously very well, it's macro studies on circularity are very limited. There are very few. And that's also, I think, because it's a complex issue that it's really hard to quantify. I am just finished a paper that I'm going to publish in the coming month about a manufacturing industry in Lithuania. So finding the drivers, that's you also a lot of similarities I'm finding with what you present here. The impact of innovation, the impact of all these international regulations and value added, and all the circular business models impact that are having also in industrial manufacturing, as same as in health. But what I'm doing, because as you said, it's hard to identify this impact because it's not easily quantifiable. I'm also including this combination of qualitative analysis, because I create a panel of experts also trying to identify what's a certain degree of even if it's a lot of criticisms could be applied, but trying to give a bit of degree of this impact coming from the experts in Lithuania, because it's a thing that it's having an impact in Lithuania, trying to model the specificities of the Lithuanian manufacturing industry. Yeah, and also I think that digitalization and medical issues and medical research has a lot of potential. They're attracting a lot of interest in the recent years also. But congratulations for that. And yeah, I'm pretty sure circularity has a lot to learn and also to offer to this interaction in between digital and medical issues. So there are also potential circular business models that could be integrated into the medical sector, making use of some digital tools also that are now.
Yeah, you're right. Yeah.
Okay, so let's check if somebody else has a question in the chat or not. And do you have some comment? Maybe.
Not much. I was I mean, it's very macroeconomics, and so there's no, for example, there is no differentiation between public expenditures, private expenditures on Earth, and I found that very often there is a huge difference between the effects and the amounts and everything on private and public expenditures. But as it's at the more macro level, I think it's very difficult to see the difference between those two types of expenditures.
Yeah, very true.
Otherwise, no other comments really.
Yeah, and actually, yes, it is a kind of macroeconomic perspective. What I tried to evaluate, how can we evaluate some opportunity in terms of the opportunities and threats in terms of health, and how can we assess the realistic combination of the circularities, you know. So that's why maybe this is the systematic thinking, as I said before. So we can give it some proof by giving some data. But here, WHO, it's not, and also WHO, it's trying to evaluate this circularity. How can we measure? And also the main challenging question for WHO also. Yeah. But this is the thinking of the opportunities and threat of circularity in health.
Just maybe a final comment also, because I just remember that there is a conference on digitalization and medical sector in Kaunas, where I just I got my previous position last year. So maybe if you're interested, I can also share information with you. I'm pretty sure that this kind of research, the one that you're doing, it's very relevant in this kind of conferences that are specialized in that. But it's very, very nice to see this systemic approach that you are printed into the health sector. So yeah, thank you very much for being here, for giving your time, Gökçe, and for giving this very interesting lecture to us. So let's keep in touch, and see you soon, everybody.
See you. Thank you so much.
Bye-bye.
Bye-bye. Have a nice day.